Hey everyone, this is Tania. So, welcome back. In previous class, we have discussed or we do MCQ from the vital parameter, that is temperature. Okay, so now in today's class, we will do MCQ from another vital parameter, that is pulse. So let's start. So the first question, that is, when a pulse rate is irregular, it is best to count the radial pulse for 30 seconds, apical pulse for full minute, apicals for 30 seconds and radial pulse for full minute. So what will be the right answer? The right answer will be apical pulse for a full minute. 1 minute we have to check the apical pulse with stethoscope in 1 minute. Then the suitable site to check the pulse, into newborn: apical pulse, pedal pulse, femoral pulse and the carotid pulse. So it will be the apical pulse. In newborn we will always check pulse in apex. So what are the sites in checking of pulse? The site for checking of pulse in normal adult. So first, that is the temporal. Then the brachial artery. So we will check in brachial artery. Then the radial artery. We will check the pulse. Then the popliteal pulse, that is behind the knee, dorsal of pedis, posterior tibialis. These all are the sites for checking the pulse. Now, the next question, that is, what is pulse deficit? What is pulse deficit? Give me the answer. It is very easy. Pulse deficit, that is the difference between the apical pulse and the radial pulse. This is the pulse deficit. So apical pulse and radial pulse, it is means 2 mm of 2 beats per minute, 2 to 3 beats per minute. So the normal range, that is 2 to 3 beats per minute. Apical pulse minus radial pulse. And what will be the if any abnormality in the pulse deficit that denote the atrial fibrillation, or any abnormal heart condition. Atrial fibrillation. Now the next question. To assess the patient posterior tibial pulse, a nurse should palpate. This will be palpate. So where the posterior tibial pulse is located? That is behind the knee, over the middle malleolus, below the middle malleolus, below the lateral malleolus. What will be the answer? It will be below the middle malleolus. The option C, that is the below the middle malleolus. Posterior tibial pulse, that is located in the ankle, in the inner ankle, and the bone, that is the below the middle malleolus. Now the fifth question. While feeling the pulse, if the beats are skipped, it is known as option A, irregular pulse, option B, intermittent pulse, option C, dichrotic pulse, and the extrasystole. So it will be, the answer will be intermittent pulse. Okay. If there is a occasional missed beat, then it will be called as intermittent pulse. Now the next we will discuss about the rhythm. There is abnormality in the pulse, abnormality in the rate, rhythm and volume. So the abnormality in the rate, it is the tachycardia and bradycardia. Tachycardia, we called it tachycardia if the pulse rate is more than 100 beats per minute, and bradycardia if the pulse rate is less than 60 beats per minute. Now, what are the abnormality in the rhythm? First, that is the intermittent. Intermittent rhythm, that we have already learned, that occasionally missed beat. Then irregular rhythm means variation in the frequency. Then extrasystole means premature contraction. It means that the ventricle contract very fast. Then the sinus arrhythmia. In this, the pulse rate is rapid during inspiration and slow during expiration. So remember the sinus arrhythmia, in which the pulse rate increase during inspiration and rapidly slow down during expiration. Then the dicrotic pulse means di means double. So sensation of the double beat. Okay, so this is the dicrotic pulse. Now, what are the changes or abnormality in the volume of the pulse? The most important is the water hammer Corrigan pulse. In this, there is a sudden, means the full volume of pulse will occur, and there will be sudden collapsing, means full volume pulse and the sudden collapsing of pulse, that is known as the water hammer Corrigan pulse. Then a bounding pulse. What is bounding pulse? That is strong pulsation does not disappear with moderate pressure. That is the bounding pulse. Then thready pulse. In this, the pulsation is not thready pulse, in which the pulsation will not easily felt. Thready means like a thread. Then the weak pulse, that is stronger than the thready pulse, but it is very fragile. The pulse is not felt easily. Then the bigeminal pulse. Bigeminal pulse is an irregular rhythm in which every other beats that comes early, okay, that comes early. It becomes, it may be so weak that it fails to produce a palpable peripheral pulse. And the paradoxial pulse, in which the pulse volume become weak during inspiration. So pulse volume weak during inspiration, that is the paradoxial pulse. Remember all the, mainly the water hammer Corrigan pulse, then the bigeminal pulse, that is the irregular rhythm in which that is in which the every other beats come earlier, and the paradoxial pulse. So what will be the answer of this? Give me that answer. A jerky pulse with full expansion and sudden collapse is known as, what will be the answer? It is the Corrigan pulse. Yes.